خير دكتور محمد، أنا دكتورة فتحية العوضي، consultant endocrinologist and president of Emirates Diabetes Endocrine Society. We welcome you in your second home, UAE, in Dubai, from Dubai Conventional Center, where we are hosting the Emirates Diabetes Endocrine Congress, our 16th edition.
Thank you very much. صباح النور والسرور دكتورة فتحية. It's a pleasure to be here with you and to meet colleagues and friends and exchange knowledge with you. I would like to introduce myself first for the audience. I'm Dr. Mohammed Al-Mehdel. I'm endocrinologist, diabetologist, diabetes technology specialist, and also specialist in islet and stem cell transplantation. I work as a medical director and diabetes technology section head at King Fahd Medical City in Riyadh, Saudi Arabia. I'm also an associate professor at the University of British Columbia in Vancouver. I work also as part-time endocrinologist at Dr. Suleiman Al-Habib group in Saudi Arabia.
حياك الله دكتور. ما شاء الله, with this all credential that you have and with the interest in technology, and as we all now know, we live in the era of the technology, so it's just not simple prescription that we give to our patient of a medication, but also we assist them with some tools. So can you just tell me, from your vast experience with technology, how technology can match our become integrated with our clinical practice?
I believe diabetes technology has revolutionized the diabetes care all over the world, and particularly in the Gulf state. If we talk about continuous glucose monitoring system, which really allows healthcare practitioner to gain more insight towards the diabetes control and the patient behavior. So they are allowed to see the blood sugar tracing 24 hours a day, and they can analyze the time above range, time below range, and time in range. They can also analyze the glucose variability and the average glucose, and so many metrics in the continuous glucose monitoring, which allows them to really care better for their patient with diabetes, and educate the patient about behavior change, and also adjust their medication to achieve the best result and improve the quality of life of our patient, in addition to preventing long-term complication of diabetes.
So as a clinician, always we say that we provide our patient with a tool, not a toy. So it's very important for us, when we use these sophisticated tool, which really help our patient as well as their caregiver, we need to provide the basic fundamental education, both to the healthcare provider, who's going to supervise them during this journey of technology, as well as to the patient and then their loved one. So you can just explore more on what initiatives, or how, if someone is starting for the first time, let us say, in a center where they want to introduce the technology, what would be your advice towards this?
Thank you, Dr. Fateh. This is a very important point that we need to discuss with our patient. Without empowering the patient with the necessary knowledge about these technologies, particularly the continuous glucose monitoring system, they may not benefit from all the potential of these systems. I use always the analogy of the smartphones. So if we use the smartphone only to answer the calls, then we are not really exploring the full potential of this smartphone. It's like the CGM. If you give the patient the CGM and you do not really teach them how to use them, how to interpret what they are seeing, how to interpret the glucose trend to adjust their behavior or medication, they may not benefit fully from this system. So I think education is very important for the patient, and this is really endorsed in most of the international guidelines. Once you give them these tools or diabetes technology tools, you have to provide also enough education for them to use these technologies and how to use it to improve their outcome, to improve their quality of life, and to improve the diabetes control, which ultimately will translate to prevention of complication and improving their quality of life.
And in terms of accuracy, because most of our patients in the past, or even currently, they are using the finger stick, glucometers type, but now we move to the CGMS. So what would you tell your patient? Because sometimes, maybe the patient and their family are reluctant when they hear this for the first time. Would I use it? It will give me the same accuracy. How it is, how it is used, for how long it can be used. Where they have to insert it. All those detail about the CGMS.
Yeah, again, this is a very important point. So all the international guidelines address this and address the accuracy of CGM, and they also endorse some accuracy criteria to make sure that the CGM we are using is accurate and reliable to take decisions. And we have very good companies in the market that really follows these meticulous parameters that they need to follow to make sure it is accurate. I tell the patient sometimes CGM is more accurate than the finger sticks, and because even the finger sticks, some of the devices are not as accurate as continuous glucose monitoring system. So it's not necessary that the finger stick is always more accurate than the CGM reading, and vice versa. Sometimes CGM is more accurate than the finger stick, so they need to stick with all the instructions are given by their healthcare practitioner, and what is the proper way to use CGM, and how to interpret the result, and how to improve their either lifestyle or medication based on what they are seeing from the continuous glucose monitoring system.
Okay, thank you very much, Dr. Mohammed. Do you think that it had changed the life of the patient since these sophisticated tools were available to us in the community?
Definitely. And I can tell you a personal experience.
Sure.
So I am not a diabetic, but I used CGM just for, I was curious to see how is it working. Mm-hmm. And when I used it, it really changed my behavior towards certain food and exercise. So I found myself when I eat, for example, banana or muffin, my blood sugar really shoots very quickly. So I changed my behavior, and I tried to limit these certain foods that increase my blood sugar, and I try to do more exercise to make my blood sugar lower. And this really applies to all of our patients. I think it can be used as a behavior modification tool, and there is a research which supports this. In addition to that, it helped them really follow the trends of their blood sugar and prevent hypo and hyperglycemia, especially with some predictive alerts and some sensors, and also the trend arrows. So this is a very good thing about these sensors.
So you think they had improved over the time since the launch of the first sensor in the GCC country? Especially now we are talking about the prediction, because most of the time our patients were, they are reacting to the readings if there's a low blood sugar or a high blood sugar. So in terms of the prediction, if you just give more highlights on this part.
Yeah, so there are some sensors which can predict hypoglycemia or hyperglycemia before it happens, 30 minutes before it happens. So that's give time really to the patient to avoid those hypo or hyperglycemia, which is very good. It can also help them achieve better outcome, or what we call it time in range. And there are some also evidence that these sensors really improved some hard outcomes like hospitalization for hypoglycemia, hyperglycemia, or acute hyperglycemia crisis like DKA or hyperosmolar state. In addition to improving the really patient satisfaction and quality of life.
Right. So from your experience, did you see that since your patient started on the CGMS, the rate of acute diabetes complication like diabetic ketoacidosis or hypoglycemia, hospitalization had reduced? Or did you study this in your center?
We have some quality project that we have done in our hospital, and we found really that time range, or which is the time in very good blood sugar that we wanted, between 70 and 180 milligram per deciliter, has improved with the use of CGM. Complication also has been reduced, whether acute, like admission with DKA or hyperosmolar state, or chronic complication as well, has improved with the use of continuous glucose monitoring system. And really the accuracy has improved over time. I remember when we first introduced CGM in Saudi Arabia was in 2015, and since that time the technology has evolved and improved in terms of accuracy, or even in terms of the easiness of use by the patient, and also the platforms which can be followed, and even how the patient can follow their blood sugar, and even the family, they can follow their loved one blood sugar and interfere in a timely manner.
So what are the indication for dispensing CGMS? Is there is restriction criteria? Is only for a type 1, or what do you think? Or what the guidelines?
In my opinion, I think every patient with diabetes should have access to continuous glucose monitoring system. But because sometimes of lack of resources, this has been limited to some category of patient. But definitely all patients with type 1 diabetes, patient with type 2 diabetes who are using insulin, there should be using CGM. Even the most recent guidelines from American Diabetes Association endorse the use of CGM even in patients with type 2 diabetes who are not using insulin. So they are really recommending using this for those patients. I understand.
Probably also for those with brittle type of diabetes, frequent hyper.
Yeah, so those goes out of question.
Yes, for them.
So they should be using CGM.
And the type 2, most probably on the basal boluses.
Yeah.
If we talk about the restriction, because I totally agree with you that these sophisticated tools need to be available for all our people with diabetes to make their life easy and to make their care is better. But if we need to be limited because of the resources that we have, then probably we need to identify which patient that we will be dispensing. But we hope in the future these resources will be available for everyone who step to our facilities or to our center, as we have to say that there should be an equity of care among our people with diabetes.
Yeah, I agree.
So Dr. Mohammed, if you just give me a journey of a patient who come to your clinic to visit you on one of your clinic days. So from the time they register, where they go to download their CGMS, or they send it in advance to you. So just explain it more.
So usually the patient comes to our diabetes center, will be seen by nurses, diabetes educator, and physician. And once the plan is put for a patient to start continuous glucose monitoring system, the patient, the physician will prescribe it, then the patient will go to the diabetes educator, where they register the patient or open an account on the platform, and they link them to the clinic or the center account. Then they teach them how to use the sensor, how to install it, how to interpret the result, and how to react to it. And there will be follow up with the patient virtually from our diabetes educator, initially every 1 to 2 weeks, until they are fully confident that the patient can use the CGM correctly and can interpret the result and can react to what they are seeing.
Sure.
And then after that, in 2 to 3 months, they will have a follow-up with their physician to discuss the result.
Right. So there is an integration, as I understand, because in most of the GCC we've got electronic medical record. So we expect that the software of these CGMS will be integrated to our electronic file, and the result will be transmitted to the healthcare provider to view the.
So in the
results.
Ministry of Health, there was a big account for the Ministry of Health, and they linked all the CGM users to this account from all over the kingdom.
Excellent.
And they created also a heat map to see the patient who are really struggling with control, then they need more support to help them care better for their diabetes. So this has really helped to save some resources for those patients who are struggling, and to concentrate on those rather than on everybody. Because the heat map will show us who is really doing well, who's not really doing well, and will give us an opportunity to focus on those who are not doing well.
Excellent achievement, I think, because it's a sort of monitoring of a KPI, but in a real time, right?
Hopefully we can see something for the whole Gulf states, and we can have heat maps all over the Gulf, yes, and improve the care of our patient with diabetes.
So I take you back, because we were talking about the clinic setup. So probably we as diabetologists, endocrinologists, we function as a multidisciplinary team. And the role of all of us is very important. The role of the educators, of the physician, of the psychologists, of clinical nutritionists is very important with our patient. So, and I'm sure in the kingdom you are providing lots of platforms for, teaching and education to prepare all those, colleagues in order to support the patient. So just tell us briefly, what initiative that had been taken place in that regard.
We have currently an initiative with Dexcom companies to form what we call it Dexcom Academy. So this academy will have different initiatives. So we will have online platform where there is an online material can be reviewed by the healthcare practitioners. There are some also online courses with the experts to discuss how to use the CGM and how to interpret reports, or even face-to-face courses to meet with all healthcare practitioners, address their concerns, and teach them online, teach them physically how to interpret the CGM reports, and also discuss any difficult patient they have. So they might bring their own reports for discussion with the expert, and the expert will give them their opinion on these cases and how to improve the care for their patient and how to follow their blood sugar. There is also in some of the initiative also to teach patients as well, because patient awareness is also important to increase the awareness about the availability of continuous glucose monitoring system, and what are the advantages over the usual finger stick monitoring, and teach them also how to react to the report trends and how to adjust their behavior or medication if needed after consultation with their healthcare practitioners.
It sounds very well, very comprehensive academy, Dr. Mohammed, and I think there's lots of investment had been done in this academy, and I think the word itself, it also means a lot that it is a comprehensive collective education for our patient, and I think that's the right thing, that the role of all the industry as well as the healthcare provider, to put all our efforts together in order, to support our patient and their caregiver as well. So I think with this academy, I'm sure that things will move in a much better way. So is already implemented and launched in the Kingdom of Saudi Arabia?
So we're going to launch it this coming Friday.
Okay, and, that's an excellent
with
news.
the first 50 healthcare practitioner.
Excellent.
So we're talking them in patches, and around 50 healthcare practitioner at a time, and we give them it's around 6 to 9 months of online and physical course until they become aware of all the CGM features, and some of them will be promoted as expert in CGM eventually, and will be working with us as instructor in the academy in the future.
Excellent.
So we are really trying to help people to understand, and some of them to become an expert to spread the knowledge over the kingdom and to all other healthcare practitioners.
Excellent initiative. So I hope this experience of the Kingdom of Saudi Arabia then will be transferred to the rest of the GCC and hopefully to our MENA region, because we have a high prevalence of diabetes and pre-diabetes. So we hope to see the next step is the UAE, inshallah, here, and we also follow the same, and we learn from also your experience, and we network and exchange in order to improve the life of our patient.
Yeah, definitely.
So is there anything more that you want also to highlight in terms of other things related to the technology, in terms of pump, islet cell transplant, where we are from this era?
I think, as we mentioned in the beginning, diabetes technology now is evolving, and it revolutionized the care for diabetes. We have been achieving better outcome, improving the patient quality of life, patient satisfaction, decreasing complication. But we have really to be careful in accessibility. So we have to make sure, or at least work on making sure that these technologies are available to everyone living with diabetes all over the world, not only in our areas, which is really going to make a big impact and difference in the life of a patient living with diabetes.
And I think we've got lots of a good partner as well into this process, because diabetes is not just about the healthcare provider, policymakers, industry partner, volunteers. It's a huge, team that we require on board in order to, to take this further. Other experience or patient experience that you want to share, Dr. Muhammad, with us?
Yeah, all the patient really likes the technology, and it really made a big impact to their life. And I can see this every day in my clinic. I'm sure you are seeing the same thing in your clinic, and all the people or all the physicians who are caring for people with diabetes. So I wish if we could really make it accessible to all the patients, to really improve their life. And I think they had enough suffering from their diabetes, and we don't want to also make them suffer from not not being able to access these tools which can help them really care for their diabetes better.
Do you think that some of your patients finding it challenging to use these technology?
It's a learning process. It sometimes can be intimidating for some patient and for some healthcare practitioners, but I think with experience and with these initiative that we are making to teach the patient and the healthcare practitioners and to support them and empower them to use this technology, I think this will be much easier for them, and they will be able to adopt more of these technologies.
Okay. And Dr. Muhammad, did you do any studies, publication, research in this? It's a very hot topic, so that we can see the the outcome in terms of, for example, glycemic control, the outcome of the acute complication, or the outcome of a chronic complication.
Yeah, so we have published a few papers from our center that showed that time in range, or time in good range between 70 and 180 is much better using CGM. We have also researched that we compared time in range to the usual hemoglobin A1C, and there was a good correlation between them, which is reassuring for us to use this technology in our patient. We have some studies done in Ramadan, which showed reduction in hypoglycemia and glucose variability, which has not been published yet, but will be presented in the next American Diabetes Association conference in June. We are planning also to study these technologies during our Hajj holiday,
Very good, excellent.
which I think will make a big
Much
impact,
needed, yes.
and a big impact on those patients during those I would say very active days during Hajj, and I'm sure we will get a good result of that.
Which is very unique to our area
Yeah.
in terms of Ramadan or Hajj. Yeah.
We have also published data on CGM plus automated insulin delivery, and which showed improvement in time and range, and improvement in time below range, patient satisfaction, and the quality of life, whether is it used during the usual days. And we have also study in Ramadan, which was presented in the last ATTD conference last year, and which showed again people were able to safely fast during Ramadan using CGM and automated insulin delivery
Excellent
system.
to hear this. And as we are just coming to the end of our broadcast, one more question. If the patient walk to you, because there are different CGMs available in the market, it's just sometimes become complicated, to the people with diabetes, which one I should choose? Or, it's just like when we have an phone, and then which one we have to use. So is it applicable the same with the CGMS?
I guess the most important thing is to use accurate and reliable sensor which has been tested
Yes.
thoroughly in patient with type 1, type 2 diabetes. It has been tested when the glucose level is changing, like after meals or during exercise. It has been tested also in the low or hypoglycemia range and hyperglycemia range. And we have to be really vigilant to this factor, because I do not think all the CGMs are the same. And it is our duty as healthcare practitioners to make sure that our patient using reliable sensor, because they are going to take action based on the readings they are seeing. And this now has been endorsed by the FDA. They come up with some certain criteria. They call it iCGM. There is also similar movement in Europe with eCGM criteria. We have also wrote a scientific statement in Saudi Arabia regarding these criteria that should be used to make sure that the patient or the CGM that reach our patient is accurate and reliable for them to use.
This is excellent and musical to our ear, and I'm sure that all efforts that is being done is toward the a good outcome and a good quality of life for our people with diabetes. I totally enjoyed this dialogue with you, Dr. Muhammad, and thank you very much for being with us here on board, and Hayakallah.
Thank you very much, and I'm happy to be in my second country, United Arab Emirates, and thank you for invitation to this conference, and hopefully we'll have more joint conferences in the future.
Inshallah. Thank you very much.